The Committee on Higher Education will come to order. Today we'll be hearing about the overview over the mediation agreement between the University of Minnesota, Fairview Health Services, and physicians. The U of M and Fairview has had a relationship as a health system over the last few years, and over the last year, they have engaged in negotiations over a new contract. The AG's office facilitated a new agreement between the U, Fairview, and physicians to renew an agreement over the next 10 years. And so today we'll be beginning with Lois Quam, who is the strategic facilitator from the Office of the Attorney General. So please welcome, introduce yourself for the record, and you may begin.
Thank you so much, Mr. Chair and members of the committee. Thank you for the invitation to speak with you today. My name is Lois Quam, and I'd like to briefly introduce myself, sharing with you that I grew up in Marshall, and I've worked at the top levels in the nonprofit, corporate, and government sectors on improving access and affordability of healthcare. I chaired the Minnesota Healthcare Access Commission that led to the legislative creation of Minnesota Care. With the 30-year agreement between the University of Minnesota, the University of Minnesota Physicians, and Fairview expiring at the end of 2026, the Attorney General convened a strategic facilitation process in April with the parties' agreement. I was designated as the strategic facilitator for the process. In December, in consultation with the Attorney General, the parties agreed to a mediation process with the mediation team of retired Judge Tom Fraser, Dr. Bill McGuire, and myself. On Friday, January 23rd, a 10-year mediation agreement was signed by the parties and announced the following Monday. The mediation agreement is the basis for a series of definitive agreements between the University and Fairview and the University of Minnesota Physicians. As a part of that agreement, the parties agreed that the earlier agreement between the University of Minnesota Physicians and Fairview was effective and enforceable and would be subject to specific amendments. The parties have agreed to complete the definitive agreement stemming from the mediation by March 31st, or at a later date mutually agreed. I congratulate University President Dr. Rebecca Cunningham, the University Board of Regents, Fairview CEO and President James Hereford, the Fairview Board of Directors, the University of Minnesota Physicians CEO, Dr. Greg Bielman, the University of Minnesota Physicians Board of Directors, and their whole teams on this important achievement for the people of Minnesota. The parties and the mediation team worked diligently over 7 weeks, only taking a break on December 25th. These organizations and their leaders are a role model for staying at the table and working through hard issues to reach an agreement that reflects a shared commitment for improved health for all Minnesotans for the years to come. They kept their eyes on the prize. They set aside past differences and misunderstandings on behalf of all of us. While each organization can speak to the agreement, I'd like to describe some of the key features. First, it is a 10-year agreement. Fairview has committed $1 billion in capital improvements over that 10 years in the University of Minnesota Medical Center and the Clinic and Surgery Center. This includes the hospitals on the East and West Bank and Masonic Children's Hospitals. The university and the University of Minnesota Physicians will provide important engagement in this process to make sure that it meets the needs of all parties. As a part of this investment, the University and Fairview will explore expansion of physical capacity at the academic medical centers and other approaches to enhance care through state-of-the-art facilities. Fairview will assume operations for the Clinic and Surgery Center, and a new lease will be negotiated with the university, given its ownership of the clinic building. They'll do this to foster integration, delivery, and management of services for patients, physicians, associated care providers, and related staff. Fairview will also forgive the operating debt the CSC owns to Fairview from the existing joint venture and assume all annual operating losses. These steps will support operations at the CSC and preserve patient care at that facility. Fairview will provide $50 million in annual financial support for the medical school, with the potential for additional funding based on system performance. Fairview also assumes the additional financial responsibilities for certain clinic services, bringing its 10-year commitment to the medical school to approximately $600 million before additional performance-based funding. The University of Minnesota Physicians, the practice group that consists of the medical school faculty and affiliated physicians, remains the sole faculty practice plan for the University of Minnesota, affirming their ability to continue academic research and teaching while practicing and training in Fairview facilities. All three organizations will collectively explore an innovative program to support local physicians in increasing the likelihood that patients from Greater Minnesota receive timely diagnosis, appropriate treatment, and necessary care for complex medical conditions, regardless of where they live or their circumstances. Fairview has committed an initial $10 million of funding to this initiative. In addition, the parties have identified ways in which they can strengthen their partnerships. The University of Minnesota and Fairview will establish a new leadership council consisting of 2 members, each from university leadership and the Fairview Board of Directors, to discuss important strategic matters and mutual needs and ensure ongoing dialogue and effective collaboration. The University of Minnesota and the University of Minnesota Physicians will establish new collaborative vehicles for achieving their shared land-grant mission of high-quality clinical care, advanced research, teaching, and healthcare workforce development. As the Attorney General said when the mediation agreement was announced, the agreement will, and I quote, will ensure that 1.2 million Minnesotans a year will continue to receive world-class patient care in our state, that Minnesota will remain a place where world-class physicians, specialists, and researchers seek to treat patients and build successful careers, and that stable, secure funding for the University of Minnesota Medical Center that trains 70% of Minnesota doctors will continue for the next generation. He further noted, and I quote, "I know all Minnesotans join me in thanking everyone that contributed to getting us to this point. It is a significant and positive development for all of us and the state we love." In close, I want to note that we're entering a difficult and uncertain time in healthcare. The recent and upcoming actions and federal reductions in healthcare coverage and access and research funding are serious. This agreement by these 3 important Minnesota organizations establishes one of the key building blocks for our success in this next era. I thank the leadership of these organizations for their vision and stamina in getting this done. Thank you, Mr. Chair and members of the committee, for the opportunity to be with you today.
Thank you so much, Ms. Kwam. And members, you have a copy of the agreement in your packets as well. Are there any questions for Ms. Kwam? Seeing none, we can go into the testifier list. Thank you so much.
Thank you so much. Thank you.
First up, we have Dr. Rebecca Cunningham, who is the president of the University of Minnesota. Welcome, President Cunningham. Please introduce yourself for the record, and you may begin.
Thank you. Good afternoon, everyone. Mr. Chair and members of the committee, thank you for the invitation to be here today. For the purpose of the record, my name is Rebecca Cunningham, and I'm president of the University of Minnesota. On January 26, 2026, the University of Minnesota reached a preliminary agreement with M Physicians and with Fairview. I would like to thank the Attorney General's Office and Lois Kwam for their deep efforts over many months to help bring this to fruition. This is an important milestone that's achieved a win-win-win that we all need. This agreement is a win for our health and our healthcare practitioners, a win for our students, for the future health and healthcare workforce, and a win for patients and now into the future. Most importantly, this agreement is the next step win for Minnesota, and it brings clarity and stability to the university's relationship with our physician group and with Fairview for the next 10 years. As you heard from Ms. Kwam, key elements include academic support. This agreement affirms the University of Minnesota's medical school's critical role in medical education, research, discovery, and clinical care, bringing stability and academic support to the medical school. It includes facilities investment. This agreement will fund much needed updates and modernizations to the buildings that are on our campus. It includes a secure physician group practice. This agreement allows our University of Minnesota faculty to pursue their dual role of treating patients and training the next generation of health and healthcare professionals in a world-class learning environment as our designated practice plan. This represents a strategic pivot. Instead of a joint venture like the current model, Fairview will be responsible for the management of the hospital operations, and the university will remain responsible for our academic and our research missions. This represents a pluralistic future that clarifies our non-exclusive relationship with Fairview. This provides us with the opportunity to creatively and collaboratively explore multiple paths to address urgent health and healthcare needs, including exploring additional and expanded partnerships to advance high-quality care across Minnesota. We recognize that our faculty and staff have been through a long period of transition. We're fully committed to them and to supporting a time of healing in our relationship with both Fairview and M Physicians. As I have said, this agreement is an important milestone, and much more hard work remains as we finalize the definitive agreements, which are ongoing now as the formal contracts are being drafted by our teams. When those definitive agreements and contracted are complete, it will help us to forge additional and expanded partnerships to serve Minnesota more broadly, a key aspect of our strategic University of Minnesota roadmap, Elevate Extraordinary 2030. Will also serve as a framework to create the definitive agreements, again, that are needed to solidify the mediated agreement for which Ms. Quam spoke of. This mediated agreement in principle was approved by the University of Minnesota Board of Regents on January 30, 2026. In addition to affirming the University of Minnesota Medical School's critical role in medical education, research discovery, and clinical care, it brings the clarity and stability needed to deliver on our vision of building a long-term solution to meet Minnesota's most pressing health and healthcare needs. As you all know, University of Minnesota is the state's land-grant university. Tomorrow marks our 175th year birthday, serving Minnesota through our mission of teaching, learning, research, scholarship, outreach, and public service. One of the ways that we do this is by working all across the health sciences, medicine, pharmacy, dentistry, nursing, public health, and veterinary science to deliver research, education, and care that changes lives across the state. At the University of Minnesota, we train 70% of Minnesota's healthcare professionals. We are proud to call healthcare professionals in all areas of the state our alumni. We know when they train here, they're more likely to stay here in Minnesota. So we want to provide even more pathways for students in greater Minnesota. In addition to our Twin Cities Medical School, we have a branch of our campus, a medical school campus in Duluth, which was founded in 1972, and we opened a CentraCare regional campus in St. Cloud last year. Our Rochester campus, University campus also partners closely with the Mayo Clinic to train future health and healthcare professionals. All of these campuses are critical to supplying the workforce for all of Minnesota, including rural Minnesota. Currently, more than 120 Minnesota communities have brought future doctors to their towns through our Rural Physician Associate Program, more than 17,000 alumni to date. This vital work is part of our goal to create a future where all Minnesotans can get their healthcare needs met, regardless of where they live. Now that we have an agreement in principle, and after we complete the definitive agreements, we can focus on how we can set the course to train the future workforce to meet the needs of greater Minnesota. Our commitment to serving all of Minnesotans is something we've been doing for a long time. I hope you'll celebrate all year long with us. Our 175th birthday, we plan to do that all year long. Our vision is to build upon these strengths and to continue to exceed all expectations. To improve health and healthcare of all Minnesotans, we're focused on the following: additional expanded partnerships offering high-quality care across Minnesota, a sustainable, stronger University of Minnesota Medical School, recruitment and training the next generation of health professionals all across health sciences and across Minnesota, expanded health innovation and discovery that leads to life-saving and life-sustaining cures, and modern patient care and teaching facilities with innovative technology. Mr. Chair, with your permission, I would like to invite Dr. Carol Bradford, our new interim executive vice president for health affairs and new interim dean of the medical school, who started a week ago, to share some brief remarks.
Yes, awesome, please.
Yeah.
Welcome. Please introduce yourself for the record, and you may also begin.
If I may, let you know, Dr. Bradford joined the University of Minnesota last Monday. She is an internationally respected leader in medicine whose career accomplishments include leading cultural transformation in a rapidly changing and uncertain healthcare environment, fostering collaborative interdisciplinary initiatives, and balancing academic and clinical missions with strategic growth in Big Ten academic medical centers. For the past 5 years, Dr. Bradford has served as Dean of the Ohio State University College of Medicine and Vice President for Health Sciences at the Ohio State University Wexner Medical Center. There, she oversees the opening of the Interdisciplinary Health Sciences Center and launched a new learning track to prepare students for rural and smaller community practice, addressing physician shortages in those areas, critical experiences she will now bring to Minnesota. With that, Dr. Bradford.
Welcome, Dr. Bradford.
Thank you, President Cunningham. Thank you, Mr. Chair and committee members. It is truly my pleasure to be here with you and participating in my first University of Minnesota Day at the Capitol. For the record, my name is Carol Bradford, Interim Dean of the Medical School and Interim Executive Vice President for Health Affairs. We have ahead of us a tremendous opportunity to transform health and healthcare education in Minnesota at a time when it's urgently needed. The foundations here are profoundly strong. The University of Minnesota is one of only a handful of public universities in the nation that works across the full spectrum of health sciences. And it is this unique collective that allows us to influence academic medicine in ways few other places can. Stepping into this new role just over 1 week ago, my priority is to listen, to learn, to appreciate, and to build trust. I am committed to working across all levels of our university and with our clinical partners and physician group to build a unified vision for the future. I look forward to continuing to partner with continuing the university's long-term partnership with Fairview President James Hereford and CEO of the University of Minnesota Physicians, Dr. Greg Beelman, and to work collaboratively to care for Minnesotans. I'm also committed to deepening relationships with partners across the state. And perhaps most importantly, to build trust with our university faculty who have demonstrated an ongoing commitment to their patients, to research, discoveries, and to our learners throughout this process. Our people are the true engines of our mission. Together with our learners, researchers, faculty, staff, and partners, we will seek out exciting new ways to move medicine and healthcare forward for Minnesota and beyond. Thank you again for the opportunity to come before the committee, and I will be coming to meet with you all during the course of the session. Thank you.
As Dr. Bradford said, we already have ahead of us a tremendous opportunity. This milestone agreement aligns with our vision for the future and our strong commitment to serve Minnesota, a commitment that's being enhanced as we advanced our strategic roadmap, Elevate Extraordinary 2030, a roadmap that will help us build a future workforce for Minnesota, especially for rural Minnesotans, serve communities through sustainable solutions at the intersection of health and the environment, and to further advance the health of all Minnesotans. Mr. Chair and members, again, thank you for wanting to learn more about this matter and for having us before the committee today.
Thank you, President Cunningham and Dr. Bradford. I have a quick question and I can open up for other members of the committee. I'm looking at the agreements at parts 9B and 9D. And can you explain in a little bit more detail about the variable payment and how that is calculated and allocated between the U and physicians?
So not having the agreement memorized and directly in front of me, and then I encourage you to ask also this question of my colleagues here who are here as well. So the support that will come to the University of Minnesota from Fairview is in two parts. There's a fixed component part which, not having the numbers off the top of my head, but in the agreement are about $50 million a year, but please look at the agreement for the number. And then a variable support. That variable support depends on the operating efficiency and performance of Fairview. In other words, if they do better, then they will provide us additional variable support. That money will then be distributed across. The fixed support comes directly to the university. The variable support comes in a complicated manner that I should not recite, but is in the agreement through UMP, essentially, to the university. But it's a little bit more complicated than that, Chair. Yeah.
Understand. Are there any questions from members? Senator Utke.
Thank you, Mr. Chair. And I know we've got two more testifiers coming up that may touch on this. I don't know, but I'll start with the university. Over the last number of years, there's been conversations and dealings with a couple of our outstate providers. And part of that was to supply locations for residencies, et cetera. And of course, they're not part of this deal, but has that been part of the conversation again to bring the doctors that are to the point where they time to spend time at a residency into rural Minnesota to finish their education, but then we in rural Minnesota, hopefully we can wrap our hands around them and keep them.
Yes.
Is that something that's been talked about yet, or will be here before it's done?
Yeah.
President Cunningham.
Yeah, thank you, Chair and Senator Utke, for that question. So I think what you're referring to, there's a couple different things. You are 100% correct, which is the best way. We have a terrible shortage of healthcare workers across both rural Minnesota and rural America in general. The best way for us to keep physicians and other healthcare providers in rural America is to have them train there, and that includes in greater Minnesota. So we have a number of programs across our academic programs at the university and at the medical school to have folks train in the place where they will then hopefully stay and work. So for example, this is part of the reason that we have a new expanded campus with CentraCare in St. Cloud, with the goal of having medical students from the area be the focus, who then can stay locally and hopefully then continue their training after that. Our residents right now train in all over and in many health systems. Only about half of our graduate medical education training, our training of residents, happens with the Fairview system. Otherwise, our residents are training with multiple partners, both in the Twin Cities and I believe also with other health systems. Is there ways we can expand that? There may be. I mentioned our rural physician program and how we do family physician training in communities. I think there's lots of ways that we can think about doing that sort of expansion. This deal that we're here to talk about today is specifically about our partnership, our critical partnership with Fairview and with the university physicians and what that looks like for the next 10 years. But then the university, from an academic standpoint, will always be looking at how we can increase training and opportunities of ways that we can successfully have healthcare providers stay here in Minnesota and work in greater Minnesota through concepts that you talked about there. Thank you for the question.
Thank you. Senator Utke.
Thank you, Mr. Chair, and thank you. I know that we're here to talk about the contract today, and it's wonderful, and I just wanted to make sure that was still on the table and such, because we just want to make sure we get them out and get them into a spot where they really enjoy finishing up their education, and then they hopefully want to stay there, because we know what it is like all across rural America, but we're concerned about rural Minnesota, and we want to make sure we've got providers to serve the patients. So I thank you and appreciate it.
If I may, Chair and Senator Utke, as I mentioned, this is an important contract and an important milestone step, but it is a non-exclusive, as has been in the past, where our training certainly can extend and our partnerships can extend to other healthcare systems and to other ways that we can have programming to support training in other parts of the state.
Thank you, Senator Utke. Any other questions from members? Senator Verbain.
Thank you, Mr. Chair. I'm looking at the infrastructure investment part of the agreement that says that the UMN and UMP will have meaningful input on the groups that work to establish priorities and plans for such expenditures. Can you share more of what the vision is for how the University of Minnesota will have meaningful input?
President Cunningham.
Yeah, thank you. And I'm sorry, I didn't hear part of your question because I was just receiving that. But I believe you're asking about the $1 billion of investment into the infrastructure, into the facilities on the campus. They're Fairview's buildings, and so ultimately Fairview will decide how those dollars get spent, although we do have, as Ms. Quam noticed, some additional committees getting set up, which hopefully can provide good ways where we can have communication about where priorities might be across those facilities.
Senator Umar
Sure, thank you, Mr. Chair. Is there like existing committees in the University of Minnesota? Are there like specific stakeholder groups that you would name within the system that would be part of establishing those priorities?
President Cunningham.
Yes, so this is a shift going forward. You know, in the past, we had a joint venture with Fairview, which meant that we also had seats on the Fairview board, and with that shared governance in some ways and input into the governance in those components. We're moving to a different step going forward now, and in this agreement, it's noted there's 2 different groups that will be set up to encourage and improve communications and priority setting across both the board members and the senior leaders of both organizations. And those are laid out here in a preliminary way.
Thank you. Any other members with questions? Not yet? Okay. President Cunningham, just for members' knowledge, can you talk a little bit about the relationship between the U and M physicians and how they interact?
Yes, and this is an agreement, the mediated agreement is an agreement in principle with both groups. The University of Minnesota faculty, when they are hired into the University of Minnesota, are then assigned a place to work, and that place to work is the 5013C that is M Physicians. So, you know, it's critically important. These are our faculty. We care deeply about them. In order to have a successful medical school and successfully serve the state, we have to help these single people who do all 3 jobs that we hire, which is teaching, research, and clinical education. We have to help that single person be able to do all 3 of those things. So, of course, good relationships, which are critical here going forward, are part of the next step. And we look forward to deeply collaborating and working closely with what will be our sole faculty practice as we move through the definitive agreement. So that is certainly part of a positive goal and future.
Thank you so much, President Cunningham.
Thank you so much.
Thank you, Dr. Bradford, as well.
Thank you.
Next up, we have James Hereford from Fairview Health. Welcome. Please introduce yourself for the record, and you may also begin.
Thank you, Mr. Chair. My name is James Hereford. I'm the President and CEO of Fairview Health Services. It's my pleasure to be here to visit with you and the rest of the committee members. Thank you for the opportunity to appear. I want to extend my deep appreciation for Attorney General Ellison, Strategic Facilitator Lois Quam, and the others for the countless hours they put in over the last year visiting our facilities and care teams across Minnesota. We're grateful for your leadership in helping us reach this point. At Fairview, our mission is to make health happen through human connection. Every decision we make is anchored in that mission. Together with our partners, we serve about 1.2 million Minnesotans every year. Fairview nurses, pharmacists, lab techs, support staff, EMS, therapists, and more work together every day. They enable patient care delivered by more than 6,000 providers in our system. These include more than 2,200 physicians and advanced practice providers who have chosen Fairview as their employer and are practicing in our hospitals and clinics. 2,250 independent physicians who also choose to deliver their care in our facilities. And 1,700 University of Minnesota Medical School faculty practicing clinically at UMMC and other Fairview facilities. Fairview is Minnesota's third largest employer. Our hospitals and clinics span the state from the Twin Cities to the Iron Range. Our overall economic impact on Minnesota is approximately $17 billion each year. And we forge partnerships that extend care and compassion beyond our walls and make Minnesota a model for community-based care. Just last year, the American Hospital Association recognized Fairview with the Foster G. McGaugh Award, the country's most prestigious honor in community health. So what does this mean? Well, it means that Fairview, much like the universities and colleges you oversee, is an anchor in the communities we serve. And anchor institutions matter, as we well know. A strong, stable, sustainable Fairview benefits Minnesotans. But healthcare is under real stress. The threats today are more numerous than ever before. Across the state and the country, health systems are navigating a brutal combination of lagging reimbursement, workforce shortages, capital demands, and ever-increasing post-pandemic costs. We need not look any further than the local headlines to see this playing out. Hennepin Healthcare, just across the river, is at the brink. They are not alone. Fairview is not immune to these forces. It has taken years of disciplined work, hard choices, operational rigor, investment in our people to return to stability. Fairview is a strong organization today, and we intend to stay that way. But the road ahead is not an easy one. We need to work smarter, innovate, and continuously improve our ability to deliver quality care, provide access, and deliver operational and excellence in order to survive and thrive to continue to meet the needs of our state, its communities, and its citizens. Higher education is navigating similar headwinds: funding pressures, workforce challenges, mission strain. I know the University of Minnesota is facing real difficulties, real challenges, at a scale and severity not unlike those that healthcare delivery systems are also facing. We are both anchor institutions in this state and facing significant questions about the sustainability of our future and how we go forward. When confronted with challenging circumstances, the answer is not to fragment. It is to come together, and that's exactly what we've done. We came together with UMP, the University of Minnesota physicians, and the providers and the faculty, caring for patients and aligned around common cause, common purpose. The answer is to build stronger partnerships, one with shared goals, clear commitments, and strong accountability to bring us through the next decade. That is what our new agreement represents for Fairview: a stronger, more sustainable partnership to support academic medicine and Minnesota's healthcare future. Over the next 10 years, Fairview will invest $1 billion in the current hospitals and medical facilities on and around the University of Minnesota campus, provide $500 million in guaranteed academic support for the medical school, which could grow further if we make progress towards shared goals, and fund $10 million to work with rural healthcare facilities in Minnesota, supporting and sustaining the crucial care that they provide. In doing so, we'll build off the care we already provide at our hospitals in Senator Farnsworth and Heitzman's districts in Hibbing and Grand Rapids. And I'll just say as an aside, the intent of this is not to come tell rural communities what they should be doing. The intent is to work with rural communities, the terrific physicians and leaders in those communities, to ask what they need. And there is certainly a staff access capability perspective, but there's also the environment in which they're providing care. The biggest challenge for rural healthcare right now are the economics. And I am both the former and incoming chair of the Minnesota Hospital Association. I've had a lot of opportunities to work with a lot of tremendous leaders in rural settings. They're very, very good, very committed, and facing incredible challenges. And the intent of this investment is to be able to work with them to understand how best we can support them in that crucial work. One of my favorite examples of this is the system has helped new parents and premature babies stay close to home in Grand Rapids through tele-NICU capabilities, connecting them virtually to UMMC NICU teams for specialized care, but allowing them to stay in their community. All told, Fairview will remain the largest private source of outside investment into the University of Minnesota Medical School. This level of support compares favorably in the 65th percentile to similar academic institutions per the 2025 Vizient study. We're proud of that commitment, and we're proud to support academic medicine. Even so, you can't have a high-functioning medical school without a high-functioning faculty. This is where Fairview's greatest contribution to the university academic mission rests. Yes, University of Minnesota Medical School faculty educate future physicians, but they also care for patients, often those with rare conditions and complex medical needs. They conduct cutting-edge research to discover tomorrow's treatments. And at any given time, medical school faculty are leading dozens of clinical trials for new therapies and studies that vex current medical problems. Doing so requires a strong clinical platform of hospitals and clinics and all of their associated capabilities where faculty can teach, train, and conduct research, as well as run their clinical trials. Fairview, in large part, is that platform. More than 1,700 UMP faculty doctors practice, teach, and research across Fairview every day. They work alongside Fairview physicians, nurses, pharmacists, technicians, and administrators. Minnesota's physician workforce is educated, in large part, in our system. Clinical trials that advance medicine happen in our system. Research that drives discovery happens in our system. Just last year, our teams at Masonic Children's Hospital, alongside renowned pediatric cardiothoracic surgeon, medical school faculty member, Dr. Pranava Sinya, successfully completed the first partial pediatric heart transplant in the upper Midwest for baby Lennox of Big Lake, Minnesota. Those are the kind of miracles that we can conduct each day through our faculty and through their capabilities in our hospitals. Through partnership between Fairview's pharmacy teams and UMP physician specialists in our Pediatric Blood and Marrow Transplant Center, we can revolutionize and bring new life-saving gene therapies and treatments to patients and their families. And this and other examples, this work creates a new hope for people with rare disease diagnoses. Teams in our system are leading the field in the use of ECMO to treat cardiac arrest. University of Minnesota physicians and Fairview teams are finding new ways to get this care to people faster. First by road and now by air. Northland Medical Center in Princeton, Minnesota is now home to the nation's first program that flies a specialized ECMO resuscitation team by helicopter to UMMC directly to community-based emergency departments. Wherever that care is needed, we're there, dramatically increasing a person's chance of survival. These are just a few of the ways that our partnership and strong clinical platform advance academic medicine and discovery. Through this continued partnership, that will not change. In fact, we believe that it can lead to even more breakthroughs in clinical practice. Our hospitals and clinics remain a broad, stable, mission-aligned clinical platform. We'll continue to support medical school faculty as we always have, and with new structures and shared goals designed to support their work more effectively than before. The foundation of this partnership is strong. The university and UMP can build on it with confidence. Fairview is a nonprofit health system. We don't have shareholders, we have patients. We have communities, we have mission. Supporting the unique capabilities of academic medicine and extending the impact to Minnesota wherever they seek care is a key part of that mission. The University of Minnesota needs a strong Fairview to fulfill its mission, and the state of Minnesota needs a strong university to fulfill theirs. These are not competing interests. They're aligned and shared goals. This agreement is how we protect what we've built together over the last few years and how we build towards what comes next for patients, for physicians, and for the state of Minnesota. Thank you, Mr. Chair and members, for inviting me today. I'm happy to take your questions.
Thank you, President Hereford. Are there any questions? Senator Clark.
Thank you, Chair. Thank you, Mr. Hurd. Having played a very small role in my other job in mergers, acquisitions, and joint business ventures and getting to the end, congratulations, all of you. Wow, it's a lot of work, and based on trust and mutual goals. The $1 billion, of course, is big and a lot and exciting. When you talk through the capital investments, is it buildings, is it equipment, is it all of those, is it tech? I assume the answer is yes.
All the above.
All right.
Yeah, thank you, Mr. Chair. Senator, yeah, it's what we do is incredibly capital intensive for all of those reasons, right? We operate in these significantly complex buildings. We have incredibly expensive and complex equipment that are managed through a technology infrastructure that in and of itself is incredibly complex. And oh, by the way, under constant attack from a cyber perspective. So The $1 billion will be an investment in all of those, and really about programs that we can come to shared understanding and agreement on that will have a significant impact for the people who seek care in those buildings. And I'll just say one of the things that, as an old operating guy, one of the opportunities, we are under OR'd at the university. There are too few, and those that we have are often too small. And that just represents the advancement of the technologies over the years. What used to be a satisfactory OR at 500 square feet, now you can't put the equipment in. And so one of the most significant opportunities for us is to expand our OR capability in that interventional platform. So I see that as one of the more pressing needs that we have at the University Medical Center.
Senator Clark.
Thank you, Chair Fate. Thank you. So I note on page 7, the mediated settlement agreement, item 11 is new tower as a potential. I assume that the operating room expansions that you need could be in that, but in the shorter term, you're going to need some short-term remodels before we could ever get to a tower concept.
President Hereford.
Thank you, Mr. Chair. Senator Clark, yes, there are things that we can do in the existing platform. There are opportunities to move things around. We're making investments in our lab capabilities to expand that. That would allow us to displace what is current precious real estate adjacent to the ORs that is used in our laboratory services. That is not the best and highest use of that real estate. Ultimately, though, as Dr. Beelman will often say, we are a 400-bed hospital with 900-bed demand. We likely will need to look at extra capacity, but we also have to think about that in the context of the nature of care is also shifting due to technology, advancement in science, precision health, genomics, et cetera, are all going to have a significant impact on what happens in the hospital. And we've seen this progression of care moving from the inpatient environment to the outpatient to the ambulatory and then to home. And so all of that has to be reconciled because the last thing we need to do for Minnesota, for the university, or for Fairview are to make investments that in 10 years somebody's scratching their head going, why did you build that? Because that demand has shifted. So we'll have to be anticipatory of that future.
Senator Clark. Thank you. Any other questions? Senator Kupek.
Thank you, Mr. Chair. Maybe less of a question and more of a comment, because I'm thinking back to 3 years ago. We had an evening Health and Human Services committee meeting. Senator Utke and I sat there, and it was the end of Fairview. It was a Sanford merger. The U did not know what they were going to do, and you have turned this ship around miraculously, and I think also President Cunningham, with your leadership, the two of you that you've come together to do this, it's not only good for both systems, it's good for the state of Minnesota. So I congratulate you both on this achievement, and because 3 years ago it was a pretty doom and gloom scenario, and we weren't sure. There seemed to be a lot of opposition to Sanford coming in, and you have managed to Fairview is in a much better place than it was even 3 years ago. So you've done some amazing things there. And I think the change in leadership at the U too has helped this process along. So thanks to both of you.
Mr. Chair,
Thank you, President Hereford.
I thank you so much. Mr. Chambers, who was the CEO at Cisco, had a phrase he used that you're not a CEO until you've had your near-death experience. That felt like mine. And it represents a $600 million turnaround over 3 years. And that was, I would like to take credit for it. I cannot. That is a tremendous amount of work done by literally thousands of people. A lot of continuous improvement, a lot of things that we had been working on started to come to fruition. But I truly appreciate the praise because, our organizations deserve the recognition of what they've accomplished. So thank you.
Thank you. Any other questions? Senator Verbain.
Thank you, Mr. Chair. I'm looking at the research section, which discusses the framework, in a shared framework. And on the UMN side, it names the chief academic officer, vice dean of research that will be involved in establishing that. And then it just names Fairview. So can you share who from Fairview would be a part of establishing that shared framework?
President
Thank-
Hereford.
Mr. Chair, Senator, yes, and we're incredibly fortunate that one of our current chief academic officers, Dr. Brad Benson. Dr. Benson is a faculty member, but he is Mr. We Together. And throughout the last few years, I can't count the number of times that Brad has talked about, the importance of We Together. And so first and foremost, we get to lean on Brad's expertise. We also have another former faculty member, Dr. Taj Mustafa, who's on my team, who also is a very good researcher, very accomplished, is a former trainee of Brad's, as it turns out, as a med-peds doc, who will be very involved in that as well. And we have a limited research infrastructure already. We really lead a lot of the work on wearables and testing wearables for a company that I can't name, but many of us are probably wearing their watches. And so we have some infrastructure already, but it's really about how do we come together with the university to think about the agendas that both promote the advancement of the science, but also the delivery of the care that is represented by those advancements in science.
Senator Umar
Yeah, thank you, Mr. Chair. And I noticed that too. It's not going to govern, of course, the research that happens at other facilities, but was just curious what that framework looks like and what kind of best practices you hope to bring into the shared framework that you have with the University of Minnesota, if there's anything additional.
Thank you, Mr. Chair. Senator, yeah, it's, my experience, I was at Stanford University for a number of years. I think that my experience would dictate the best way to go about this is in building the kind of relationships where you can talk through the many competing issues and look for that common ground. And I think in many ways, this new contractual relationship has given us a platform upon which to do that at almost every level of the organization, both at the governance level, at the leadership level, and then at the, the place in many ways where it really counts, which are the people doing the work. And being able to bring them together to talk about what exactly, working within the established framework, what are the things that we need to focus on? I think I would suspect that my physician colleagues would agree, we're at the beginning of a Cambrian explosion when it comes to precision medicine and precision health. How genomics will play out over the next few years in terms of informing both treatment but also prevention is going to be breathtaking. And the University of Minnesota plays a key role in that, has advanced that science significantly, and our ability to translate that into the bedside and how does that then impact care? I think there's immense opportunities for us to think collectively about that.
Thank you. Any other questions from members? Thank you, President Hereford.
Thank you. I appreciate the opportunity.
Thank you. Last up, we have Dr. Greg Bielman, who's the CEO of M Physicians. Welcome. Please introduce yourself for the record, and you may begin.
Chair Fate, members of the committee, thank you for the opportunity to share the role of the University of Minnesota physicians on behalf of the university's medical school and to talk about our relationship with Fairview Health Services. For the record, my name is Greg Bielman. I'm a surgeon and ICU doc at the University of Minnesota, where I've been faculty for 30 years. I currently serve as the CEO of our practice plan, the University of Minnesota Physicians. I practice, teach, and do research as part of the University of Minnesota Medical School faculty. I'm a retired Army reservist with deployments to Kosovo, Iraq, and Afghanistan. We've provided detailed information on the size and scope of our medical school physician practice plan, UMP, in your member packet. Happy to go over that in more detail if you have a desire to do so. I believe the University of Minnesota Physicians plays a unique role in healthcare in Minnesota. We are physicians and other providers who practice, teach, and conduct research. We are constantly seeking better treatments and outcomes for our patients and for the communities that we serve. It's our role to share what we learn, not only with our students, but with our colleagues in the Fairview system and the other systems throughout the state of Minnesota and the upper Midwest. We work with 46 systems throughout the state and the upper Midwest with more than 270 contracts for service throughout those systems, as well as our primary partner, the Fairview system. Again, your packet has more details on the partnerships that we have throughout the state, but it's the individual stories and what we do every day as providers that really makes a difference. I want to tell you about two sisters, Malia and Lauren, who are from Canby, Minnesota. They were born with a condition called hereditary chronic pancreatitis, painful and debilitating condition, usually diagnosed in adults. Malia and Lauren, unfortunately, were both under the age of 10 when they were diagnosed by a university physician. They were referred to us when Malia had continuous ongoing episodes of hospitalization caused by nausea, vomiting, and abdominal pain, and they couldn't figure out what was going on. After the diagnosis of pancreatitis, we learned that her sister Lauren had the same unfortunate genetic mutation. We're fortunate at the University of Minnesota to have an amazing team of doctors, nurses, dietitians, endocrinologists, others who are interested in this disease, thank God, and they were able to provide both sisters long-term relief through a procedure invented at the University of Minnesota called a total pancreatectomy with an islet auto transplant. It's a tricky operation, involves removing the entire pancreas, isolating the islet cells which produce insulin, and then retransplanting them into the liver of the patient. This requires the work of a team of healthcare providers, not just the talented surgeon, but that team to really help take care of these patients long-term. And this gives these people great outcomes long-term after surgery. Today, both these kids are several years recovered from their operations. They live full, active lives back in Canby, Minnesota, like every kid deserves. The physicians of UMP are able to practice this type of transformative care thanks to the relationships both with the university and with our major clinical partners, Fairview. I came here 30 years ago to work at the University of Minnesota, to train here, and stayed on because of that amazing relationship. It's important that we keep our ranks of physicians and APPs strong, growing, and focused on innovations in care, not just care, so that we can continue to provide that type of care to all Minnesotans. The new agreement, oh my gosh. At the end of 2025 and into 2026, with the help of my friend Lois Quam here on my right, Attorney General Keith Ellison, and a mediation team, including Tom Frazier, Lois Quam, and Dr. Bill McGuire, we have begun to turn the page on a new chapter in this 30-year relationship with UMP, the university, and Fairview. I want to extend my deep thanks to both University of Minnesota President Rebecca Cunningham and Fairview Health Services President and CEO James Hereford for their engagement in this process to bring us to the on-ramp for the next decade of service to the people of the state of Minnesota. We are excited about UMP's renewed partnership with Fairview and the final details of master's agreements in the works between UMP and the University of Minnesota, and believe that that helps provide a sustainable healthcare future, not just for our patients, but for the faculty like me 30 years ago who come here with excitement to make a difference, to get better at what we do, to help our patients do better with terrible diseases. It's important to understand that the physicians and providers of UMP are the clinical faculty of the medical school. The students that we teach learn to care for patients alongside us in our clinics and in university hospitals. You can't learn to be a doctor without taking care of patients. You can't research translational care without researching that on patients. So we must care for patients. Just a brief aside, I was at a neighborhood party about 10 years ago, and I said, oh yeah, I'm a faculty at the University of Minnesota, I work at the medical school. They said, do you actually see people? So yes, of course, we see people. UMP supports the long-term sustainability of academic medicine in Minnesota. If you look at the U's medical school finances, the single largest piece of the pie that supports the medical school comes from the practice of the doctors at UMP. That makes sense as our revenue pays the salaries for the medical school faculty, physician, and both in Fairview hospitals and clinics, and again with those other 46 health systems and clinics where we practice. There is more information in detail in your packet about that approach. Last year, when the Attorney General stepped in, there was a significant risk of potential damage to that long-term sustainability to the medical school. We needed this new agreement, and without this new agreement, UMP's service and patients' access to university doctors across Minnesota would contract with about a $400 million reduction in revenue, funds that pay for the salaries of our doctors and those that support our doctors in the medical school. This had the potential to lead to about a 30 to 50% loss of faculty at our medical school moving forward. I'm really grateful we've avoided this scenario and that we've given greater stability for our faculty and a stronger healthcare future for our state. After we signed our agreement with Fairview in November, one of our subspecialists pulled me aside and said in a very relieved voice, "Thank you for doing this. Now I don't have to move my family." This makes a difference for the doctors, for the faculty that I serve in my role. Since that time, I've had numerous faculty physicians reach out to me to express their gratitude to UMP, to the university, and for Fairview to come into an agreement that stabilizes and supports this practice into the future. President Hereford has already talked a bit about the investment in the future of the medical school related to this agreement with Fairview. That's also in your packet, and I'd be happy to answer more questions about this as you ask. I also want to note that the $50 million of fixed support that Fairview provides to the medical school each year will support time for our faculty to do those things like teaching and research that are less well compensated than specifically just taking care of patients. The writing of research grants in 2025 resulted in $350 million in grants to our faculty to research new treatments and therapies for Minnesotans. Our separate mediated agreement with the University of Minnesota reaffirms these investments in addition to affirming us as the sole premier clinical practice for the medical school moving forward. This designation is critical for the stability of our faculty, and it's also critical as UMP's status as an independent nonprofit entity supporting the medical school. This provides faculty benefits, provides protections like sufficient malpractice insurance, and provides other benefits that keeps them secure and engaged in their work. This model, the one that we currently have in place, is a best practice structure which is maintained by many highly ranked peer-reviewed or peer medical schools throughout the country, including those at the University of Wisconsin, the Mayo Clinic, and Washington University in St. Louis. Our commitments and partnerships with the U and Fairview empower the University of Minnesota physicians to fulfill our role in the medical school's tripartite mission of education, clinical care, and research for Minnesota. It supports how we serve patients like Malia and Lauren, and it helps UMP stay competitive in retaining and recruiting highly specialized and deeply caring doctors to teach the next generation, to care for our patients, and to innovate for the future across the state. As referenced by Ms. Quam earlier, Minnesota needs this care from us now as we confront challenges in the years ahead. Higher rates of uninsured patients, sicker patients resulting from delays in reaching care and seeking care, and more, and our new agreements prepare us to delivering on that promise. Thank you for the opportunity to address you folks today.
Thank you, Dr. Bielman. Are there any questions from members? Seeing none, thank you so much for taking the time, Doctor.
Thank you.
And with that, I think that wraps up the testimony. Next Thursday, we'll be hearing this Thursday, we'll be hearing Senator Putnam's Minitex bill, and OHI will provide an update on the projections around the North Star Promise and the state grant. So thank you all so much, and this committee is adjourned.